The main aim of the Neonatal Resuscitation program is to teach all skills and steps necessary to resuscitate and stabilize newborn babies who've not breathed or cried at birth. This tutorial in several parts is based on the textbook of Neonatal Resuscitation 8th edition and the Advanced NRP Workshop Manual that was published in 2021 as a joint initiative by the Indian Academy of Pediatrics and the National Neonatology Forum.
My name is Dr. Vijisha. I'm from the OG department. We have a 31-year-old mother who is having leaking PV and she's under labor pains and she's posted for LSES in the next 30 minutes.
Okay, I have few questions. What is the gestational age of the mother?
She's 38 weeks gestation.
Is the liquor clear?
No, she is MSL grade 2.
Okay. Is the mother is having any other additional risk factors?
Yes, she's having gestational diabetes and she's on diet and gestational hypertension on treatment.
Okay. As the mother is having grade 2 MSL, regarding the cord management, if the baby is having any distress, we'll immediately cut the cord and shift the baby for resuscitation. However, if the baby is otherwise well, we'll perform the routine steps over the mother's abdomen and then we'll perform delayed cord clamping. Okay, I'll brief my team and I'll get my team ready and we'll be on time for the LSES.
Sure.
Thank you.
Thank you.
Dr. Sujita. Hi Dr. Meenakshi. We are going to have a LSCS shortly. It's a 31-year-old mother who has come with labor pains and she's having leaking PV and it's grade 2 MSL. Mother is also having gestational hypertension. She's on treatment and she's also a gestational diabetes mellitus on drugs. Okay, they are going to have the LSCS in another 30 minutes. So I'll be the team leader. So I'll be allocating the jobs that you have to do. I'll be taking care of the routine steps. And I will do the intubation for the baby. Can you do the back and forth ventilation for the baby or are you confident in doing it? Okay. Dr. Meenakshi, will you be able to take care of the UVC and the drugs such as adrenaline and normal saline? Are you confident in doing that?
Yes, ma'am.
Okay, we'll be having the delivery shortly. We'll go to the delivery room and then we'll keep the equipments ready. Okay?
Before you begin, close all the doors and windows, switch off the air conditioning and the fans, and keep the room temperature above 25 degrees Celsius. All the personnel involved in resuscitation should wash their hands for 40 to 60 seconds as recommended by the WHO and wear gloves before assembling equipment and supplies.
Now we are going to perform the equipment check. We have to keep the radiant warmer ready. I'm going to switch on the warmer and switch the mode to manual, which will give 100% heat output. The skin probe has to be connected to the warmer. Then 2 warm towels for receiving the baby, Deeley's mucus extractor, stethoscope, shoulder roll and PPV with term and preterm mask and 8 French NG tube, 20 ml syringe and oxygen flow meter with the tubing and pulse oximeter with the probe. Then for intubation, laryngoscope blade with the 0 and 1 size blades and endotracheal tubes with the size 2.5, 3 and 3.5, scissors, endotracheal tube securing tapes, inch tape for measuring the nasotracheal length and drugs such as NS saline 100 ml we have to keep and then adrenaline with 20 ml syringes, few 5 ml, 3 ml and 2 ml and 1 ml syringes. We are going to use 5 French tube for securing the UVC with the stopcock. We can also use UVC catheter also. This is the term mask. I am going to insert the mask through the nozzle in the ambu bag. Then we have to check the ambu bag by keeping the mask close to the palm and then with gentle pressure we have to give. Now I can feel the pressure. To check the pop-off valve, we have to give little more pressure. We can see the raising of the pop-off valve.
Make sure that the bag reinflates quickly when you release it after squeezing it.
And to check the reservoir bag, we have to connect the ambu bag to the free flow oxygen, and then we have to increase the flow. Now we can see the bag inflating.